ma'am. My name's Angie Bicknell. I'm the Director of Radiology at Moorhead Memorial Hospital.
David Wicker, would you please report to the County Manager's Office? David Wicker, County Manager's Office. Thank you.
I've been the Director for the last 2.5 to 3 years at Moorhead. Prior to that, I spent about 19 years in the mammography world. And so I'm very familiar with mammograms, stereotactic biopsies, ultrasound core biopsy. The one thing that I haven't really dealt with a whole lot is breast MRI, because that's a little bit different territory than mine. I have been in North Carolina for the last 23 years. I've worked at various different health facilities. I've been at Moorhead for 9 years. Prior to that, I have been in Statesville at LandL Memorial. I've worked at Duke. I've worked for Greenfield Radiology. And I've also worked at Alamance. When I was young and single, I did move a lot. I didn't have a reason to stay still. But anyway, with all that experience, it gave me the opportunity, even though I was still doing mammograms at different places, I was a supervisor in the lead tech. It gave me an opportunity to meet different people and different women throughout the state of North Carolina. And a lot of my coworkers I'm still friends with and so forth. Now that I'm in the director role, I'm still involved in the mammography department because that's one of the departments that I am still over. Just so you know, there's 6 modalities at Moorhead in the radiology department. So I'm still involved with the mammography department. I just have a supervisor who takes care of the daily operations there. At Moorhead, we do have digital mammograms. Greenfield Radiology is the radiology group that comes and reads our mammograms. And on Tuesday is the day that we have what you call a diagnostic mammogram day. We do screening mammograms the rest of the week, and I'm going to explain a little bit more on the difference of those in a few minutes. And we do diagnostic mammogram and breast ultrasound on Tuesdays. And if a patient was to need it, we do ultrasound breast core biopsies on Tuesdays while they are there at the hospital at our Right Diagnostic Center. Breast cancer. I'm sure it's affected someone that we know. It is an uncontrolled growth of breast cells. It is abnormal changes in the cells. And with those abnormal changes, it creates a tumor. That tumor can be benign or it can be malignant. It can be seen on the mammogram or it cannot. There is a few percentage of cancers that are not seen on the mammogram. And a lot of those are the ones that presents a symptom. I'll talk about that in a minute. So breast cancer refers to a malignant tumor that develops from cells in the breast. A lot of the information that I'm talking about today, the statistics and so forth, I am getting from the American Cancer Society website, in case you want to go back and you can go onto their website and you can see the specific statistics for breast cancer on their website, okay? Breast cancer is the most common cancer among American women. About 1 in 8 women in the United States will develop invasive breast cancer during their lifetime. Now they specifically state invasive. Usually it's just stated as breast cancer, but invasive breast cancer is where the breast cancer is found in the breast and it's already spread throughout the body. It's spread into the lymph node and beyond the breast. For 2014, the American Cancer Society estimates that 232,670 new cases of invasive breast cancer will be diagnosed in women throughout the United States. About 62,000 new cases of cancer that is non-invasive, which is the earliest form of breast cancer, will be found in 2014. And about 40,000 women will die from breast cancer in 2014. Breast cancer is the second leading cause of cancer death in women. It's only exceeded by lung cancer. Even though death rates from breast cancer have been declining since about 1989, the largest amount of the decreases have been in women that are younger than 50. The decrease of the number is believed to be the result of women getting mammograms, earlier detection, and increased awareness, and improved treatment for breast cancer. At this time, there are more than 2.8 million breast cancer survivors in the United States. This includes women that are still being treated and those who have completed treatment. Breast cancer is not just a woman's disease. It's mostly a woman's disease, but it can be found in men. For 2014, the American Cancer Society estimates that 2,360 new cases of breast cancer will be diagnosed in a man. They estimate, American Cancer Society estimate that about 430 men will die from breast cancer. Even though it's a whole lot smaller percentage, but men need to be aware that if they feel a lump, or if they have swelling, or something abnormal in the chest area where the small amount of breast tissue is, they need to talk to their physician because they can get breast cancer also. By women getting more mammograms and having more screenings, it has increased the number of breast cancers found before they cause symptoms. The most common symptom of breast cancer is a new lump or mass. And that's the importance of having the mammogram because a lot of times by the time you feel the lump, the cancer has become a little bit more involved and possibly has spread throughout the body. Some other symptoms of breast cancer, just because I mentioned these symptoms doesn't mean you automatically have it, but some other symptoms that you need to be aware of, that if these symptoms happen to you, you need to call your physician. It's important to call your physician and not wait till that 6 months down the road for that yearly mammogram. You need to go ahead and call your physician, and they can go ahead and schedule a diagnostic mammogram, and then the radiologist will recommend, if there's any further workup that's needed, such as a breast ultrasound and so forth. But some of those symptoms include swelling of all of your breasts or part of your breasts, even though there's not really a lump that you feel. Again, remember, these symptoms are not necessarily automatically breast cancer, but it's definitely something that you need to talk to your physician about if you start experiencing these. Skin irritation or dimpling, nipple retraction, nipple pain, or breast pain that is just in one area of your breast, not all over. Redness or thickening of the nipple or breast skin. Nipple discharge other than the breast milk. These symptoms do occur. I have seen them. Not every day, but I have seen them. So please make sure that if you have any of these symptoms, that you do not ignore them. Even though you may have had your mammogram 2 or 3 months ago or 6 months ago, it is still important to evaluate your body and to examine your breasts on a monthly basis. I have a little brochure that talks a little bit more about that. I'll go over it. But it's important to know how your body is and so forth, and what your body looks like, so that you can see if there's any changes, any symptoms, so that you can call your physician and have a discussion. Because just because you had that screening mammogram, let's say it was June, and everything was normal, but yet you've got this new symptom or sign, doesn't mean that you shouldn't have another mammogram, but the thing is you need to talk to your physician. He's the one, he or she is the one that needs to help you decide what you want to do. So, yes, it's important for us to have our yearly screening mammograms. And while I'm on that topic, the American Cancer Society does recommend for a woman over the age of 40 to have a yearly mammogram and to start having a mammogram at age 40. And I can tell you that my group of radiologists agree with that. For a woman to start having a mammogram at age 40 and have them on a yearly basis. I know it's been 4 or 5 years ago when we had that statement by someone in the national government was age 50, but American Cancer Society still recommends age 40 when you start having your yearly mammograms, and so does the radiologist of being radiology. So with mammograms, the goal of the screening exam for breast cancer is to find the cancer before they start to cause symptoms such as that lump or that swelling. And I have a breast model that I'm going to show you in a little bit, and I'm going to get you to actually feel. You'll be able to feel what some of the larger lumps are. And when you can feel a larger lump like that, then more than likely it's already spread a little bit further than early detection by the mammogram. So, mammograms. I know that they are uncomfortable, but it only lasts a second. And I know different women have different experiences and different levels of pain with the mammogram. But it's very important for just that second to take care of yourself and have that mammogram. Most screening mammograms is 2 to 3 pictures of each breast, depending upon the patient. And then the next step is a diagnostic mammogram if they have to come back for additional imaging. The other reason why we would do a diagnostic mammogram versus a screening mammogram is screening mammogram is a patient that comes in and they're not having any symptoms, no lumps. We do the mammogram, and later on that day or early the next morning it's read by one of the radiologists. The diagnostic mammogram is for someone who is having a knee problem, such as a lump or swelling or nipple discharge. Even if they've had that screening mammogram 6 months ago, they can still have that diagnostic mammogram of either that breast, one side. Of course, after they talk to their physician, and that's what he recommends for them to do. The diagnostic mammogram, we would be doing additional pictures for a lot of different reasons. If you had a screening mammogram and we would call you back for additional pictures, it's because the radiologist wants to look at an area with some different pictures. And usually when we do different pictures, we're either magnifying the breast tissue or we're using a different paddle than what you would use for a screening mammogram, because that other paddle is specifically focusing on the area of breast tissue that the radiologist has specifically requested that we do additional pictures of. Sometimes it's a little confusing to patients because once they have that diagnostic mammogram after a screening mammogram and they call back and the radiologist tells them everything was normal, and that's great news. It really is. But then they think that it was something that the tech didn't do positioning properly. And that is not the case. The situation is that when you have screening mammograms, that's the purpose of having the screening mammogram, is for the radiologist to see if there was any changes from the mammogram you had today, to the mammogram that you had a year ago. And if they do see changes, then that's when they do call the patient back. Doesn't mean that there's always something malignant. Sometimes it's just overlapping breast tissue, but we don't know that, and radiologists don't know that until we bring you back and do specific pictures. Or it could be an area that they want to look at with the ultrasound after we do the additional imaging. And then, of course, sometimes it does lead to the diagnosis of breast cancer. So it's always important to have your screening mammogram, and when they call, and if they call you back, please always go back for those additional pictures, because the radiologist wouldn't ask you to come back if he didn't feel like that was necessary. or if he didn't feel like that we need to look at that particular area of breast tissue with some different pictures. Breast ultrasound. A lot of people wonder, why don't we use breast ultrasound as a screening tool? The reason why, I can't speak for 10 years from now because technology changes, but the reason why right now we do not use breast ultrasound as a screening tool, we only use it after you do the mammogram and if further workup is required. Breast ultrasound does not show all of the breast tissue like the mammogram does. There are things on the mammogram called calcifications. And those calcifications cannot necessarily be seen on ultrasound. So that's why we always start with the mammogram as the screening tool. And the breast ultrasound is used as a tool after the mammogram has been done and the patient comes back for a diagnostic workup on the mammogram. And then at that time, let's say, I'm just using this as a theory example here. Let's say there was a mass seen on the mammogram. When we brought the patient back for additional imaging, we would use a smaller paddle to specifically compress on that one area of breast tissue. When we did, in this particular case, it wasn't overlapping breast tissue. It was still a mass when we did the smaller paddle. So in that particular case, the radiologist would recommend for the patient to have ultrasound. And what we do at Moorhead, when we bring the patient back for a diagnostic mammogram, we do that ultrasound that same day. And then after the ultrasound helps the radiologist to determine whether that mass is solid or whether it's a cyst. Most times if it's a cyst, they don't have to do anything else. But if it's solid, the patient has to have what we call a needle biopsy or a core biopsy. And we do all that on Tuesday. Most times we do not let the patient leave until we have done all of it because we want that patient to be taken care of all in that one day. So, if the mass comes under ultrasound and it's solid, we go ahead and do the core biopsy. That is what determines the core biopsy. The pathology report is what determines whether or not the cancer is malignant or if the mass was benign. So none of that can be determined until you have that core biopsy. That is the final thing that determines whether or not a tumor is benign or malignant once they see it solid on the ultrasound. Okay. Any questions so far? So, can breast cancer be found early? Yes, it can. Number one, have your screening mammogram. Number two, go see your physician. I don't know how often you see your physician. Everybody's different. They can do a clinical breast exam. That's important for them to still do that. It's important for you to have the mammogram, the clinical breast exam, and then do yourself have a breast self-exam. It's important for a woman to do all three because you may, again, see a symptom, whether it's a lump, swelling, nipple discharge. You may see that in between that year of you having that yearly mammogram. Because unfortunately, cancer sometimes grows that fast. So it's important that you do all three. Have this yearly mammograms. Have the clinical breast exam by your physician. And then know your own body. And do the breast self-exam. If you're not sure how to do the breast self-exam, I've got a little pamphlet. If you didn't get one, there's some on the table over there. And talk to your physician about that. If they feel like that you're doing it the right way. So I will go over each of these pamphlets a little bit, and then I am going to go. We'll show you this little breast model. This first pamphlet, again, if you didn't get one, there's some over that table you can share with someone. The ABCs of breast cancer, early detection. In here, it talks about the mammogram, the breast breast exam that you actually do. You should be doing a breast exam on yourself once a month, approximately the same time of the month. And then a clinical breast exam by your physician, depending upon how often you go to see them, once a year or every 2 years. But remember that all women can get breast cancer. Some people think that because they do not have a family history, that they can never get breast cancer. Unfortunately, breast cancer starts somewhere, so you might be the first person to get breast cancer. Matter of fact, about 80% of women who get breast cancer do not have a family history of breast cancer.
What was that percentage?
80%. So please remember that just because you do not have a family history does not mean that you will not get it. We hope that none of us get it, but please remember that just because you do not have a family history does not mean that it's not important for you to take care of your breast health. The older you get, the more you need a mammogram. A woman of 70 is almost twice as likely to develop breast cancer in the next year as a woman of age 50. But that doesn't mean that the woman that's 50 shouldn't get a mammogram. Some important reasons to get a mammogram, and I know I've said this before, but it's very important. Please do not let the uncomfortableness, or some people will use the word pain, of the mammogram. If for some reason or other it is just so painful, please talk to the supervisor or the director to see, if you can get someone different the next year. Every technologist is a little different. Of course, I'll brag about mine. They are really good, the ones I have. I've trained 2 of them. But, a woman that's been doing this as a technologist for 20 years or so, you're probably, you're not going to be probably pulled around quite as much as someone that's only been doing it 3 to 5 years. But that doesn't mean that that person that's only been doing it 3 to 5 years is not a good tech. It just sometimes takes a little time to get it down pat. I still learn a few things every day because every patient is different. Doing mammograms is not just laying someone on the table like for a CT scan and they just lay there and they go into the scanner. Doing mammogram involves the positioning of the breast. And so if you have a really bad experience, please do not hesitate to call the supervisor, the director. If it's at Moorhead, call me. If it's somewhere else, call the director. Because they need to know about it so that they can educate that technologist. There's always, all of us, I'm sure, even in this room where you work at, there's always room for improvement, process improvement, in our world, positioning improvement. Because we do not want you to have a bad experience. I'm not going to stand up here and tell you it won't be uncomfortable for a second. Because I have them every year, so I know it's uncomfortable. But you should never go away with it just being so terrible that you don't want to ever have it again. So if you ever have that experience, please call the supervisor or the director. Because having that mammogram is a whole lot more important than worrying about the pain. Because you don't want that breast cancer to develop and you go 3 or 4 years without having a mammogram. I've seen people who go 3 or 4 years without having a mammogram, and by the time they come back to have that mammogram, it's because they actually feel something. And by then, it's too late. Because the staging of the breast cancer is already long gone and they don't survive. So please do not, and I'm just telling you that because I know that one of the reasons why a lot of women do not want to have a mammogram because they say it's painful. It shouldn't be just so painful that you never come back again, I will tell you that. I'm not going to stand up here and tell you that it will not be uncomfortable. Because it is. But it should be at that level to where we appreciate the technologists and we know we want to go back next year so that we can continue to have those mammograms and take care of ourselves. Okay. I'm not going to go through the tips for getting a mammogram. Let you read that. And I'm going to let you read the cancer facts for women. Again, it says breast cancer is the most common cancer that women may face in their lifetime. It can occur at any age. So it is important that a woman start at age 40. American Cancer Society recommends them every year. Green for radiologists, the radiologists that read the mammograms for us, they recommend every year. And we do not have a specific age when you stop having a mammogram. That's going to depend on your health, what kind of condition you're in. Because if you're a healthy 80-year-old, don't stop having a mammogram because you may live, till you're 90 or whatever. So there's no specific age limit of when to stop. That's a discussion that's between you and your physician. Any questions before I get to the breast model?
I have a question. I know that there's a new 3D technology for doing mammograms.
Yes, there is. Not everybody in the United States has it yet. We do not have it yet. We have digital mammograms. The 3D, the difference in that and what we have is still a digital mammogram. And basically what they do is they still compress your breast, and I'm going to have to just demonstrate it to you. But whereas a regular mammogram, you stand there, the picture is taken and so forth, while the picture is taken on the 3D, the machine itself goes back and forth several times. So you're still getting compressed. You're still having the 2D images, which is what the regular digital is, which is what we have at Moorhead. It's just you get those extra few pictures. It's just came out in the last couple of years, so not everybody has it yet, because you have to purchase a brand new machine. It's not something you can just add to your machine. I think there's still a lot of studies out there of difference of opinions. I can tell you that if you go and you do research and so forth, I will tell you that the Breast Center of Greensboro does have the 3D. Not that I want to come Moorhead, but if you really feel like you want to have the 3D, right now the Breast Center, I think is the only one, and I'm not sure about Solus down in Greensboro, but I know that the Breast Center has a 3D. Now I can tell you that one of the things that they are working on is I'm not sure if all insurances cover the 3D. Okay, because it is the extra pictures. And what the 3D does is it's supposed to give a little bit more detail of information than just the regular 2D digital, which is what we have at Moorhead, which is what everybody has. It's just supposed to go that one extra step to give a little bit more detailed information. I think right now that they're still doing studies about it, but I think there's the possibility that it may eliminate certain people from being called back for additional imaging and so forth, because they're seeing that extra detail of the breast tissue.
Now, what about the thermal imaging?
I'm not that familiar with that because I think the Breast Center of Greensboro doesn't do that. I think Solus is the only one that does that in the Triad area.
There's a doctor in Greensboro, I can't think of her name.
Dr. Bertrand.
No, she's really into natural health and all of that, has vitamins and stuff like that. Katrina, do you remember who she is? Elizabeth Vaughn, that's her name. She does the thermal.
Yeah, I'm not really that familiar with that because that's not something that we use in radiology.
Okay. I'm just curious about it.
Yeah, I don't really know a whole lot about that, I'm sorry, but that's not something that we do in radiology. We only do the mammogram, whether it's the 2D, which mostly everybody has 2D digital, and then the different facilities are getting the 3D.
So I didn't realize that the digital was considered 2D as opposed to the new 3D one. So that's interesting.
We just don't call it 2D because it was, but we do now because they've come out with the 3D.
Well, it just gives the nation a better understanding, I think.
Yeah.
Because I never realized that the digital was like, it was 2D, so.
Well, when I first came into mammography, I was at Alamance, was my first place, and Alamance was the only hospital 23 years ago that was still doing what you call DWAS mammography, which is the blue and white toner paper. And so then they came out with film screen. And of course, if you talk to some techs that are older than me and have been in mammography, they'll tell you about some of the old ways that they used to do mammography. And so then it was film screen. And then we went to digital. And Moorhead's been digital probably about, I'd say about 7 years we've been digital. And so now the newest thing that's only came out in the last year or two, and like I said, not everybody had it because you have to purchase a new machine to do it. It'll be one of the things on my list, but is the 3D, which you still have the digital mammogram, it just has those extra pictures. So if you really want to feel like after research and so forth, you want to have the 3D versus the 2D, then talk to your insurance because not all insurances that I've heard right this moment is paying for it. But that doesn't mean that it's still not important to have just the 2D digital. That's still important for every woman to have. But if you can go have the 3D, that's wonderful.
I just have a couple of comments to make too. You were talking about the symptoms. I just would like every lady in this room to know that you still need to get your mammograms whether you have symptoms or not, because you can still have breast cancer without symptoms.
Correct. And she is correct. And that's the purpose of having the yearly mammogram. Because the yearly mammogram is for early detection, to find what we call calcifications, or find the little minute mass before you ever feel it. And that's one thing I'm going to show you on this breast model. So that is still the importance of having the yearly mammogram. Because the yearly mammogram is for women who are not having symptoms, and it is to try to find the breast cancer long before you ever feel it, so that your chance of surviving is really great, and your treatment and everything allows you to survive and continue to live a long life. So, any other questions? I'm gonna go ahead. Yes.
Sorry, just one question. As far as like some articles I've read about it, I haven't got to the point where I have to have them yet, but the radiation that's involved with the mammogram, is it true that the radiation itself can cause as many cases of cancer as not having mammogram?
I will tell you this. Now, radiologists can answer a little bit more detail than me, but I can tell you that the amount of radiation that you get from a mammogram every year is very, very small. You probably get more natural radiation out where you go throughout the year than what you realize. So the amount of radiation from having a mammogram is extremely small. And with radiation, whether it was a mammogram, whether it's a CT scan, or whether it's a chest X-ray, the one thing you have to remember is that you have to weigh the benefits versus the risks. And I can tell you now that the benefit of having a yearly mammogram and finding that breast cancer early is a whole lot more of a benefit and better than the risk, because the amount of radiation you're getting from mammograms is so small. Okay? Don't ever let that keep you from getting mammograms.
And I just wanted to reiterate what you said, because I'm a radiology tech too and been for 20 years. And we have to wear these dosimetries just to kind of keep up with how much radiation we're being exposed to. And doing it for 12 hours a day in the OR, and there's nothing there but you in that C-arm. And they monitor it every month. And I've still had less radiation than, let's just say, my husband working outside. So it's very minimal, extremely minimal.
I have a question. As you age, the breast tissue becomes more thicker and denser. And with breast cancer being so much more prevalent now, what recommendations do you have with for women that come in and they get the report, your mammogram is normal, however, breast tissue is big, and how do you, because insurances are becoming so, you know, they don't want to authorize additional, do ultrasound, do MRI, what avenue, what do you tell these women when they have a family history, a mother had breast cancer, sisters had breast cancer, and then you get the report back, the mammogram is normal, but the tissue is dense, and you know, breast cancer can hide in that dense tissue, what do you tell them, how do you pursue from there?
Well, I would not be the one that would talk to a patient in that particular situation, because it's going to be up to, if a patient gets a normal mammogram and they want to pursue, and the reason why, I don't know if you had your mammogram in the last 6 months, is that North Carolina has become one of those states that has the breast density law. California and Texas were the first 2 states. And North Carolina is, I don't know if they're the third state, but they are one of the other states that have the breast density law. And that basically, if you go have your mammogram, if you haven't had a mammogram in probably, let's say, 9 or 10 months, you'll probably see a difference in your letter that you receive from your facility the next time you go. Because in that letter, we are required, and of course it's determined by the radiologist, not by me, we are required to designate and tell you the density of your breast tissue. Now, from that, the only thing I can tell you is that digital mammograms is the newest, latest technology that we all have that is great for dense breast tissues and fatty breast tissue, okay? Because film screen did a good job, but digital is the newest technology that goes even further with the dense breast tissue and showing all the calcifications and so forth. Now, the breast density law requires us to tell you in your letter that you have dense or fatty, whatever type breast tissue. And I think it states, and I apologize, I don't have a specific letter in front of me. I think it may state to consult with your physician if you want to have further testing and so forth, because it's not something that we can say, you know, you need to have an MRI because your mammogram is normal. We're not the ones that can state whether or not you need to go have an MRI because of dense breast tissue. Now, I'm not going to stand here and tell you that radiologists, I can't say whether they would tell you that or not, because I'm not them. But the best thing to do is talk to your physician, because you know that is the situation is I don't know about insurance. I don't know if they would cover an MRI because you had a screening, you had a normal mammogram. I don't know if they would cover an MRI. But with all that being said, if you feel like that you would want to have an MRI because you have dense breast tissue, then that's something that you would need to talk to your physician about. Because that's the person that's going to be the one that has to order it for you. That's the one that is going to have to take care of following up for you. You know, the radiologist may have a conversation with the patient, but the patient's physician is the physician that's going to have the final conversation before that patient goes any further once the mammogram is normal. That's not something that we can get involved with that, because your physician is going to be the one that has to follow up with your care and everything and give the order.
May I add something to that? May I add something to that? I feel like if you are that concerned, then it's worth paying for it yourself. For your own peace of mind, to go ahead and pay for your mammogram yourself.
You mean the MRI? 'Cause
Yeah,
I think
the
that's the
MRI.
piece that
Yeah,
she's
the
in.
MRI.
And I have to agree with her. I just can't say that, we would recommend it, because every patient is different. Every situation is different. But North Carolina does have, it just came out in the last 6 months to a year with the breast density law. And you can find it on the internet, go to North Carolina breast density law. And it's basically to inform the patient. That doesn't mean that we're going to be recommending you to have anything different once you have that normal mammogram. That is just to inform the patient, and then it's up to the patient and their physician if they want to do anything further. And again, if you have a strong family history and you feel like you want to pursue with the MRI, then talk to your physician.
So what was the driving force? I'm just curious because this is something that's coming up, and I guess it's with the breast density law, that you're seeing this more women getting the mammograms in the report. But what was the driving force that they had to say now, the breast density law? Was it that breast cancer was hidden and I mean, why now with that?
Probably politics. It was probably politics because what California and Texas does, a lot of other states follow. As in, were we finding more breast cancers than in the past? Not necessarily, no. It's just that they wanted to make sure, California and Texas wanted to make sure that their patients were informed. So North Carolina and some other states are following suit. They want to make sure that the patient is well informed. It does not mean that we're missing any cancers with the digital mammogram. It's just that they wanted to give the patient the information that they do have dense tissue versus fatty tissue. And that if you want to pursue the MRI, then that is something that you would need to discuss with your physician. And if you really feel like you want it, then discuss it with your physician. Because they're the ones that are going to have to help you to get it. They have to provide the order and everything. And they have to talk to the facility. Because don't ever hesitate to talk to your physician about anything. Because, you know, I can't tell you what to do or what not to do. The only thing I can tell you is that the American Cancer Society and ourselves and the Green's radiologists, we recommend you get a mammogram yearly. And I'll tell you about the symptoms to see. If you have any signs, talk to your physician. But once you have that normal mammogram and the breast tissue is dense, I can't tell you what to do after that. That is something you're going to have to talk to your physician and y'all discuss what is best for you, because every person is different. This is the breast model. I'm not going to pass it around, because it's best to examine it when it's laying flat like this. But I am going to show you the example at the top is some lumps that you can't feel. And the reason why is because those lumps was found by a yearly screening mammogram. So they just want to show you that this is an example of there's something within your breast that is a lump that the yearly mammogram detected long before you ever felt it. And that's the purpose of having the yearly screening mammograms. Okay? And then at the other 4 areas is some different size lumps to kind of give you an idea of what a lump feels. Now these lumps, I'm going to tell you, are a little bit bigger than some lumps. Some lumps are the size of a green pea. To me, these 4 lumps that they've got in here are a little bit bigger than that. But I do want you to know that a lump can be the size of a green pea, and I know that's very small. But I have had women over all these years that I've been in mammography that have come in because they do the self-breast exam every month. That they know how their breast is supposed to look, feel, and so forth. Sorry. And so they will come in and they have felt a lump that's the size of a green pea. And that, you know, and that's what we're supposed to be doing. All 3 things. The mammogram on a yearly basis, a screening mammogram because you haven't felt anything, and we want to make sure we find something before you feel something. And then do your breast exam yourself on a monthly basis, and then a clinical breast exam by your physician, whether you see them yearly or every 2 years or so. So I'm going to leave this up here in this little diagram. Please come up here. It's important because I have had women in the past. Well, I wouldn't know what to feel if I did feel something. And so this is a good time for you to feel and understand that, I think it's in one of those brochures that when you examine your breast, there's a couple of things you should do. And you really need to go over this with your physician a little bit more in detail. Is when you examine your breast the first time, do it lightly. But there may be something at the edge of your skin. And then dig a little bit deeper with your fingertips, the pads of your fingers. And see if you feel something, because you will see that you have to really compress on this breast to feel the lump. Okay? So please come up here and do that. It is very important. Because like I said, I have had women in the past to tell me, well, I wouldn't know what I was feeling if I was to feel something. So please come up here and do that. Any other questions or anything?
How long ago did you say the breast density law came into effect?
Breast density law in North Carolina came into effect within the last, I want to say within the last year. I don't think it was 2 years ago. I think it was within the last year. If you go to the internet and do North Carolina breast density law, you'll see there is a website there. And it goes a little bit more in detail. Again, it's basically where we will inform you on your letter. And then if you have a normal mammogram, if you want to pursue an MRI, and it would be an MRI, it would not be an ultrasound, because we don't do screening ultrasounds. If you want to pursue an MRI, that is a discussion that has to be between you and your physician. And I'm not saying the radiologist may not necessarily be involved, but as a whole, it would be between you and your physician if your mammogram was normal. Okay? Because he still has to, your physician still has to provide the care for you, the order, and, because whatever the results are with that MRI, your physician is the one that needs to be involved in the follow-up care plan. So it's not something that the radiologist is just going to recommend for you to go have a screening MRI. Yes, ma'am.
Is there a more optimum time of the month where you may be able to feel like as far as your body cycle?
Probably with your cycle, you probably want to do it about a week after your cycle finishes. Yes, you don't want to do it before, about a week after. Okay. Any other questions? So what are the 3 things we need to be doing? Yearly mammogram, because the purpose of the yearly mammogram is because you're not having any symptoms, and you want to have the yearly mammogram so that they can catch something early, so you can have the best treatment, best care, and you can live for a long, long time. The second thing is the breast self-exam by yourself, where you do your monthly breast check. And then the third thing is your clinical exam by your physician. Okay? Well, I hope everything I've said is informative. If you have any questions, you can call me. I'm at Moorhead. My name's Angie Bicknell. You can just call and automate it. If you have a question that you feel like you'd like to talk to a radiologist a little bit more in detail, please feel free to call me. I have an actual breast specialist radiologist there on Tuesday. And if there's a question that you feel like that you would like to have answered a little bit more in detail than what I can answer, please do not hesitate to call me. They'll be glad to answer your questions. And then, of course, call your physician, because your physician has to be involved with your care. Because that's one reason why we in North Carolina, not all states are the same, but in North Carolina, we do not do a mammogram without having seen a physician within the last year or 2. Because your physician is important. And in North Carolina, you have to have your physician involved with your care. Okay? All right. Thank you for your time today. I really do appreciate it.